Hello, my name is Matthew GIBB, and this presentation is entitled Disclosing a Diagnosis of Young Onset Dementia, a Best Practice Model. So there's approximately 5,000 people aged under the age of 65 with a diagnosis of dementia in Ireland. The disclosure of a young onset dementia is often very, very complicated, and this can be due to a number of reasons. Some of these may be because they're rarer subtypes of the condition. Symptoms may not be memory related. They could be behavioural or language related, for example. They could be linked to a genetic or to a metabolic condition. And there could be young children or families involved. People can still be in employment, and there's often associated relationship difficulties or care stress involved. So this slide here, this highlights some of the work that we've been doing with the National Dementia Office in relation to a dementia model of care for Ireland, and this involves everything from the pre-assessment and referral pathways through to the assessment itself, through to the disclosure of the diagnosis and any post-diagnostic supports. For preparations for pre-disclosure, these are things that can be done in advance of any disclosure. So we would advocate that the environment that you choose to do the disclosure is appropriate, that it's quiet, comfortable, and private. So again, not in a busy ward setting, for example. And if possible, choose a non-clinical setting that's got good lighting, heating, adequate seating, and I'm not forgetting a box of tissues in case people get upset. Personnel-wise, we would recommend that there's a consultant or a senior doctor involved and a senior social worker to deliver the diagnosis. And this allows for better support of the person with dementia and their supporter throughout the process. And we would also say that dementia is not a diagnosis that a person should receive on their own. And we very strongly recommend that family members or a supporter are involved. Obviously, this is with the prior agreement with the person with dementia. There should also be protected time for the disclosure meeting. We would recommend at least an hour for the disclosure itself, and any distractors such as mobile phones, smartwatches, computers and such like should be turned off in advance. And be prepared for any meetings that overrun, because these are emotional occasions and people do deserve your time and attention. And have any written information booklets and stuff prepared in advance. The disclosure itself, it should be disclosed with kindness and compassion, and I can't say that strongly enough. We should be addressing the person directly, maintaining good eye contact, and the eye contact should be with a person with the dementia and not to their carer or supporter. We should be using clear language that doesn't involve medical jargon, and we should be empowering the person to ask questions throughout. Remember, the feedback should be balanced, so we're talking about the person's strengths as well as the areas that they may be having difficulty. Give a name to the condition, don't use euphemisms. Explain what the term means in language that's understandable to the person themselves, and make sure to provide the diagnosis in either a written or in a format that the person can take away with them. Allow people the space to express themselves emotionally, and make sure that you respond appropriately for that. Fostering realistic hope, this can be very, very difficult, but it's also very, very important. So we should be talking about things that can be done for the person. This involves things like symptomatic medications, but also about brain health, about the importance of mental, physical, and social activity, diet, etc. And we'd also be very strong about talking about normalization and making sure that people's patterns of life and everyday activities remain as close as possible to the regular circumstances and way of life. Post-diagnostically, any strategies or supports should be personalised for the individual. And we'll be looking at things like, for young onset anyway, we'll be looking at things like employment advice, making sure that people are aware of their legal rights and protections. In relation to finances, we'll be trying to see if they have any mortgage protections, insurance policies and such like. And then we'll be looking at other individualised strategies. Follow-up arrangements, these should be done within 4 to 8 weeks of the diagnosis itself. There should be regular and ongoing support for the person, and they should also have a main point of contact going forward. And any referrals onto other services should be done with the agreement with the person with dementia and their supporter. And if you'd like to know more about this, please see our website here, www.dementia.ie, and look at our information booklets and e-learning opportunities. Thank you very much for your time.